If you live in Nigeria, you are in Nigeria, or maybe possibly live outside Nigeria, you probably would have come across the word health insurance. Is this something you're very familiar with? What is your perception? What do you think about it? What have you heard about it? Is this something you've already signed up to? Now, these are questions that so many persons really want to know about, which is why today on Gyna Plus, we've decided to talk about health insurance. Good evening to you and welcome. My name is Doris Mayim. This is Gyna Plus, a program that talks about health issues that affect women and girls in the society. And today we're taking a step further, not just women. Even though this affects women, it affects you, that's a man. So which is why we want to talk about issues surrounding health insurance. And if you will agree with me, your health is one thing that, for instance, health emergency is something that can drain your pocket if you're not really ready, or something that meets you, unexpectedly. So today, health insurance is what a lot of persons, find succor in. And if you're not very much prepared or not aware of it, you might not understand how it works, which is why today we want to talk about this. And trust me, this will interest you. So after the break, you're going to meet my guest. Please stay tuned. Welcome back. If you just joined us, you're watching Gyna Plus right on Afia television, and this is where we talk about health issues that affect women and girls in the society. Like I mentioned a while ago, today is a bit different. We're talking about everyone that is, as long as you're alive, as long as you're healthy, as long as you fall sick at some point in your life, this also concerns you. This program comes up every Wednesday at 6 p.m. And yes, there's also a repeat broadcast on Saturday at 8 p.m. And today, like I mentioned before, we're looking at issues around health insurance, and you get to know more about it, how you can go about it. If you have questions, we have an expert in the studio who will talk about all of these. And talking about an expert, joining me is Dr. Ken Chukwuemeka Ogbu, who is a state coordinator, National Health Insurance Authority, Enugu State. It's good to have you on Gyna Plus, Doc. Welcome.
Thank you, Doris.
You look calm, amazing, well put together. Perfect gentleman look.
You're flattering me.
Welcome. Welcome.
Thank you.
The discussion for today is one that so many of us really do not want to talk about. When we talk about health insurance, it's always, it's either for rich people, or it's not because I don't fall sick often, or it's not for me. I have different kind of perspective, really. But to begin with this conversation, just put us through. What is it really when we talk about health insurance? Talk to us about the basics.
Thank you very much, Doris. Health insurance is simply a social security system that guarantees every Nigerian or residents in Nigeria affordable health care without financial burden. And we have a National Health Insurance Authority as a regulator, promoter, and integrator. So they regulate every health insurance industry in Nigeria, the HMO, the private plans, and the public plans. Okay. So the health insurance in Nigeria comes to stay, and the law establishing health insurance, amended law in 2022, had made it compulsory, mandatory for all Nigerians. Even though the health insurance in Nigeria is fragmented, the federal, that's the national health insurance, and the state health insurance at the subnational levels. So we are moving.
Okay, thank you for putting that straight. It's now compulsory. That kind of really, and how many persons really know about it? That's not for you to answer. Just me thinking out loud. Okay, how are we faring when it comes to issues around health insurance? Talking about we citizens, you are a body that regulates, like you rightly said. What are the numbers saying? Do you think many Nigerians have gotten to a point where they would, even without making it compulsory, say I need to have a package that insures my life in future or something?
If earlier before now, we have drawback. It was not the law establishing first law establishing health insurance in Nigeria didn't make it compulsory. So when we realized that we're heading nowhere, unless it's made compulsory. So that's why the law was amended in 2022, so that health insurance in Nigeria would make compulsory to every Nigerian and residents in Nigeria. So health insurance has impacted positively the lives of people, those who understand the impact of health insurance. They have been using it, and they have been testifying. And that's the problem, like you said. There are many people in Nigeria that are not aware of health insurance because most people are so busy and people are not serious about their health care. You can agree with me that if you go around, including this studio, there are many of you that who don't even have not even heard of health insurance. They don't care.
Probably would have heard.
So yes, probably have bet you don't take it serious, and that is the problem. As we are here to enlighten you, to let you know that that's the only way to go. That's the only way. Health insurance is the only way we can touch the lives of the downtrodden.
Okay, I mean, I like where this discussion is going. Over the years, even in recent times, we've seen different cases play out. You see people come online sometimes with very severe health issues, soliciting for funds. Sometimes hospitals will kick them out. Some different cases. I'd like you now holistically talk to us about the, like I know you said earlier that it's very beneficial. It's something that the downtrodden would, benefit from. But in a more practical sense of the word, I'd like you to tell us how important, like how important this is really. Talking about health insurance generally.
Yeah, like you say, the people who solicit for funds. So this is something just patchy sum of money could take care of. If they enroll into the health insurance through our agents or through the National Health Insurance Authority itself, this patchy sum can solve this problem. And you can agree with me that if you are conversant with our programs, you see there are a lot of interventions we are doing. That is very wonderful, unbelievable. We take care of people with fistula, free of charge. And if you go to villages or some rural areas and see people suffering from fistula, the stigmatization in that area, they don't come out. They don't go for meeting churches and town meetings because of stigmatization. And we have taken care of them 100%. Pay for their health care, the first repair, second repair, their feeding, their transportation to and fro from their destination.
Now, this was from a government like
yes, from the National Health
Insurance
Authority. Yes, there are other interventions we do touching the lives of the poor, like CMON program, comprehensive emergency obstetric care, where we take care of women that has obstetric challenges, complications. So, and it's free of charge.
It's free.
Yes.
Now, when you say free, now we're just starting the year. A lot of persons want to probably have a lifestyle change. They want to be more deliberate about their choices. And you said you could come to National Health Insurance Authority, for instance, to enroll.
Yes.
What are the basics? What are the steps? What are the procedures? Because I might not want to use a private firm, for instance, and I said, let me subscribe to a government parastatal. What are the modalities generally?
It's very simple. The process has been made so simple that even a man person on the street can enroll. Yes, because just have your NIN.
Okay.
The moment it's imputed, all your data is out.
I don't have to pay any money.
You pay. If you're coming as a private individual.
Okay, private, you mean I'm not a civil servant?
You're not a civil servant.
Okay.
You're coming as a private individual. So you could have what we call GIFSHIP, Group, Individual, Family, Social Health Insurance Program. You fall into that category. There's another category for organized private sector like yours.
Okay.
Can come in to enroll their staff.
Okay.
And there's another category, the Basic Healthcare Provision Fund for those in the rural areas, sponsored by the National Health Act 2014.
Okay.
So for you to enroll as a private individual, from 1 to 2 persons, you will pay 78,718 naira.
For the whole year?
For a year.
Oh.
So for 2 persons. If you're coming as a person,
okay,
or you're coming as 2, you pay better. Between 3 and 9, you pay 38,718 naira each. So you can see the reduction. And when you pay, calculate this 38,718 naira times the number of people who are coming. We have a discount of 5%.
Wow.
Then from between 10 and above to 1 million, to how many million to thousands, you have 38,718 naira times by the number of people. If it's 1,100, we have 7% discount. So you can see that we have made it possible that even private individuals, market women, barrel pushers, organized private sector like you can enroll.
Wow, it's getting really interesting. I must say that while this is something that I like to create awareness, it's also opening my mind to a lot of things. Okay, so for someone who wants to choose a particular package now, if I come to NHIA, for instance, if I'm coming as a person, I'll get to pay more. So if I'm coming with my family members, I pay less. That's the long and short of what you said so
Yeah.
far.
Yes.
Now, we've also had cases of it doesn't cover different certain illnesses. Let's say, for instance, you need to do a surgery, there's a package that it might not cover. Now, that is some of the complexities that some persons I spoke with mention about, that they don't, that are deceitful. They don't open up until you're in the hospital. They tell you have to pay extra money. I'd like you to address that a little bit. Is it because, would you say the gap is coming from the fact that some of these bodies do not give proper, information? They don't educate people on what they're expecting, or it's just really a bottleneck, so to speak?
It's a very wrong narrative that we don't cover this, we don't cover that. It's very narrow. Those people are not informed.
Okay.
And that is why they need to be sensitized.
Okay.
They need to be informed because we have a very robust benefits package that can take care of almost, in fact, the health insurance in Nigeria has one of the best benefit package in the world. So, this particular sum of money you pay cover, like I mentioned before, primary level care, secondary level care, and tertiary level care. So we're not taking care of. Some people say that it's simple. Malaria. There's no sickness. No malaria. No malaria is simple. Anything that can kill is not simple. We undertake surgeries of different kinds, all kind of disease, and even preventive medicine. So anybody who says that we don't take this, we don't take that, no, the person is not informed. You need to know your rights. We have a very robust benefit package that go to hospital is placed at the point of entry in every hospital, at desk office, NHIA desk office in every hospital. We decided to place QR code that displays the benefit package
Oh.
for health insurance, and also have a poster. Maybe after this program, I'll give you one.
Oh yeah, sure.
That we place at the desk office of every hospital, of every accredited hospital. Because we need to accredit the hospital that we're going to use. Not every hospital. Go for inspection and see that the hospital is ripe to participate in health insurance, treating our enrollees, and we accredit the hospital. So we treat virtually, we have only few exclusions. Those ailments that is being treated by another institution. For example, HIV and AIDS, we have NACA that's in charge of that one. Then we have self-sustained injuries.
Okay.
If you climb the upstairs and decide to go and die.
What if it was an accident?
Yeah, if it's an accident, it will say self-sustained injuries.
Okay.
But if it's an accident, yes, we'll take care of it.
You're still watching Gyna Plus. I'm getting really interested in this conversation because there's a lot that is unfolding. Prior to the kind of narrative we've always had about, some of us have always had about health insurance, there's a clear perspective now. So if you're watching this program and you think that there's something that you're missing out or probably want to know more, I would advise that you stay glued to your TV, because after the break, we're going to continue more, because this second part will be focused on hospitals, because we've had stories of how hospital would probably keep you for 5 hours because they can't find your record or something. And we have someone here who will clarify all of that. Stay tuned. Gyna Plus returns in a moment. Welcome back. If you just joined us, you're still watching Gyna Plus on Afia television, and trust me, this conversation is one that we've never really had before on this show, and it's something that's quite unique, talking about health insurance and why it's important for people to open their minds to it. My name is Doris Mayim, and in the studio is still Dr. Ken Chukwemeka Ogbu, who is a state coordinator, National Health Insurance Authority, Enugu State. We've been talking about quite a lot. We talked about what people normally miss out, the misconceptions around health insurance, and now the issue I want us to talk about is, I know that you've covered so much and there's still a lot. This is going to be a 2-part series, by the way. So the part where sometimes off camera I talk to you about it, I have been with someone to the hospital. I mean, she was in labor, and apparently the whole record thing was what kept her for a very long time. She was taken in, but no treatment really happened like that. And it's a hospital that, and she's under a private firm, by the way, not your own. But I'd like you to generally talk about it, since you're a regulator, the bottlenecks. It's something that has made a lot of persons tell you that no, I don't want to sign up because I rather pay and get express, access than just wait because I need to go through. They call it free. So talk to me about that. Why these bottlenecks exist and possible ways that it can make it a bit more seamless.
Anyway, I will not doubt that we have pockets of bottleneck, but the trajectory is changing.
Okay.
Yeah, recently we developed what we call 1 hour protocol, code authorization protocol, that you will not exceed 1 hour, even if an enrollee is to be referred to a secondary level, tertiary level care. You must not exceed 1 hour. If it exceeds 1 hour, the hospital is at liberty to refer to the secondary or tertiary as the case may be and inform NHIA office.
What if it's an emergency?
If it's an emergency, you don't even wait. If an emergency, you must take the person, and then where do you continue with other processes? We've been telling the hospitals this, we have stakeholders engagement, and we explain to them, caution them that they should not take laws into their hands. Then the enrollees also should know their rights and privileges. Very important. We've been going to some MDAs to sensitize them. We've written to all the MDAs to invite us for sensitization so that they know their rights and privileges. But the problem is that we're always in a hurry. We don't want to listen and know this is our rights. This is what we are going to do when we get to the hospital. And that's why we went to as far as placing that benefit package, that QR code where you get the QR code, opens, you see all your rights and privileges, okay, so that you'll be able to get in touch with us if they are not handling you the way they're supposed to handle you.
Okay, so very briefly, talk to us about some of these rights. So, for instance, I might come as a private enrollee, for instance, and I get to a hospital and I'm not properly attended to or probably kept for a very long period of time. What am I supposed to do?
In as much as health insurance and the HMO have a private plan with HMO, we regulate.
Okay, talk to us about that.
So, you have every right, because even if we are doing reconciliation or payment, hospital and so on and so forth, we include even private plans. If they are owing any private plan in HMO is owing any provider, we have rights to get the money paid to that provider because it's our job. We are in charge of all the health insurance in Nigeria.
Okay.
So that you have a private plan with the HMO or you are into a National Health Insurance Authority, it doesn't matter. Provided it's health insurance, we are there to protect you. And that's why we say we regulate, we integrate, and we promote.
Okay, but what are my basic rights in that scenario now? What am I supposed to hold on to and say? Perhaps more like challenge them and say, this is my right.
That is why you need to know the benefit package.
Okay.
And that's why we say, this QR code, you know your rights.
Okay, something.
And your benefit package. With this benefit package, you'll be able to know what they are supposed to do for you.
Okay. So that's.
And if they don't do it, you get in touch with the NHIA office.
Okay, and then
we have our hotlines, okay, where you can get in touch with us. So it's very important. You have the right to be attended to as fast as possible. You have a right to drugs. The only thing you pay is 10% cost of the drugs. We call it co-payment. Why do we introduce that? To avoid abuse of the system.
Okay, I like where we are going. So I've signed up for a particular plan, for instance, and I'm meant to go to the hospital. And if I'm supposed to have some medications, I have to pay 10%.
The cost of the drugs only.
Oh, okay. So that means just
if you undergo surgery,
okay,
you're not paying any money. Investigations, you're not paying any money, except high-level investigation like CT scan and MRI, where you need to pay 50%.
Oh.
So, but other investigations, ultrasound, other scans, you're not paying any money. The only money you're going to pay is 10% cost of drugs, prescribed drugs. You calculate it, if 10,000 naira, you pay 1,000 naira.
Okay. Okay.
And you have right to know the total amount of money the drug costs before they give you 10% to pay.
Okay. Okay.
So it's good we know all these things because you go to the hospital, they calculate 10% of the cost of all treatments. And which is wrong.
Wow. I'm sure if I'm as shocked as you are. I mean, that's the expression right there, because I think it's something that we probably didn't actually know as much as you're explaining it now. Because like now, it's easy to think that 10% is from the entire treatment and not just the medication you're receiving.
Just the drugs.
Wow. Thank you for putting it really out there. Now, we are going to wrap up this episode very soon. And before we go, I'd like you to talk about some of the misconceptions that people have always had. Now we are starting a new year, and some persons already have New Year resolutions. They want to be better. They want to be more intentional about their health, and they want to start planning, perhaps going this way with the way you made it all seem. You made it really simple. I didn't actually know it was this simple. And they've always had issues with, what if I don't fall ill? So they get to take my money. So if I sign up for a package, for instance, yearly, and in the entire year I fall ill like once, and it's not even something that will have to make me go to the hospital, I'll have to just dash them. So that has been, I spoke with some people, that has been like the narrative.
That's a misconception.
Okay, so
You know,
well, what if they don't really go to the hospital? So
see,
they
what you should
reach
go
the other
to,
guy.
you're a Christian. You go to church and pray God to give you sickness so that you enjoy your money, isn't it?
No.
Good.
No.
That is the essence of health insurance. Okay. Pooling of resources into a basket. The healthy, we use contributions of the healthy to subsidize for the unhealthy. The rich for the poor. That's the concept of health insurance. That insurance you see there. If it doesn't happen, you thank your God. There are some people in this country, when they ask them to pay 1 million naira every year so that they don't fall sick, they're ready to pay.
Of course.
Look at it. Look at pattern of 38,780 naira a year.
Oh, that's
if you go and consult a doctor for malaria or what you call typhoid, so the drugs and some investigations, it will cost more than 38,000 naira.
Sometimes, yeah.
Yes. Go for cesarean section where you charge 500 and 600 something thousand naira. How many years will you pay 38,718 naira to cover that amount?
Yeah.
You see that it's almost free.
So that's a wrong narrative.
Just a wrong narrative that you pay money, you must. These people feel that I'm not going to be sick because I'm young. If I pay this money, what are you, God? Okay. Are you holding your life? You can come out now, bike will hit you, and you needed to be rushed to the hospital. One treatment will cost your contribution for more than 10 years.
All right. Thank you so much for putting it straight out there. Now, this is a women's focused health program show, rather. And women are watching. Sometimes we are mostly the people who get to benefit more, childbirth, surgeries and all of that. And sometimes because that they have to sign up, most of them would have to sign up maybe with their partners or family plan. But I'd like you to generally speak about it, how this benefits women holistically.
A lot. Well, a lot of products we have for women, like the basic healthcare provision fund, that we have greater percentage of women who have benefits from basic healthcare provision fund. That in Enugu we have about 260 wards, political wards, and we have one PSC covering that ward under the basic healthcare provision fund. We also have comprehensive emergency obstetric and newborn care, where we are taking care of the maternal. We have maternal care. All the pregnant women that has obstetric issues are taken care of free of charge.
Okay.
Then we have also people living with HIV and AIDS. We have also people drug-resistant tuberculosis and non-drug resistant tuberculosis. We are taking free Anambra and the Ebonyi Center. We also have fistula. We are taking free of charge. We pay for transport, and it's center of women. It's a gender. Mm-hmm. So we take care of women from transportation to the venue, then to the hospital, and back to the house, and even the repairs, first repair, second repair, the drugs, everything is free of charge, no co-payment. And the hospitals are happy. The only center we have in the southeast is Norfolk, Ebonyi, and Abakaliki.
Yeah.
So women, you can see that we are gender sensitive, and women participate, benefiting immensely in our program.
All right.
Our Director General is not playing with this maternal health.
All right, thank you so much, Doc. Okay, so if you've been following through, we've been discussing on the topic health insurance and why it's really important that people have a different narrative prior to what they probably would think about health insurance. And I spoke with some people actually, and we'll just take the next few minutes to look at that clip, what they think. I'm glad enough that my guest in the studio has, talked about, debunk some myths, but we'll still listen to what they have to say. And right after that, we'll say goodbye on the show. Stay tuned, we'll be back. Welcome back. If you just joined us, you're still watching Gyna Plus Radio on Afia Television. And it's been a whole lot of information on today's episode. And my guest in the studio, Dr. Ken Ogbu, has done justice to this topic. And I mentioned to you that it's not going to be a one-off conversation because there is much more that we should cover than just using 25 minutes to talk about. So we'll just take a moment now after you listen to these people to talk about their concerns. Some of them have already tackled some of these misconceptions and concerns that were raised. But then again, as we're wrapping up this conversation, Doug, I'd like you to, we're coming back next week to still continue this discussion. But for this moment now, what is your word of encouragement? What is because the year is just starting as well, what would you like to tell people watching you now as regards the whole concept on health insurance?
Okay, what I want to tell our people is that this Christmas, the year is ending. The only gift you're going to give to the people in the village, in the communities, and your loved ones, is to get health insurance for them. So that when you come home, you sleep. Nobody will be coming to knock at your gates. I'm sick.
My child is this. I was hospitalized.
That's the only gift you can give to. Yes, bag of rice and tomatoes, they are important, but health is wealth. Anybody give health care, and even the government, the state government, they start up their formal sector and increase enrollment. That is where they touch life of people directly.
All right.
So I employ people to adopt people, what we call adoption method. You can adopt 100 persons and pay for them.
All right.
So it's going to help.
Thank you so much. And that's why we call it a day on this week's edition of Gyna Plus. And of course, I've been discussing with Dr. Ken Ogbu, who is the State Coordinator, National Health Insurance Authority, Enugu State. And of course, we'll be back next week to talk more about this. Remember, this is Gyna Plus, and we have an active channel on YouTube, Afia Culture and Lifestyle. There you can get all of the information we've talked about so far, so you don't get to miss out on any important conversation. My name is Doris Mayim. See you next week.